Babak. Doctor, how are you?
Cheryl. When I found out I had parathyroid disease, I looked for the best doctor. And I realized that Dr. Larian was the one who was the expert. So I'm pleased. I haven't had the surgery yet, but right now I'm really happy with everything.
So that really tells me that your parathyroid gland is not responding appropriately to the calcium level in your blood, which is what it's supposed to be doing. Parathyroid glands control the level of calcium by affecting three things. They affect the amount of calcium in the bone. So when the calcium level is low in your body, they go to your bone and make the bones release calcium, which is what causes osteoporosis. They go to your kidneys and tell your kidneys to get calcium back out of the urine. They also tell the kidneys to produce an active form of vitamin D, which helps you absorb calcium more effectively from the intestines. So these are the three ways the calcium levels come up because of parathyroid hormone. Now, in the past, the surgery was done that where you would go in and find all four parathyroids. At this point, we don't think that's necessary anymore because we know before we do the surgery which one is abnormal. And in knowing that, we can go in, hone in on that one, get that out, and then confirm that we've done the right procedure by doing blood testing immediately during the operation that shows that the parathyroid hormone level comes down to an appropriate level. Your thyroid comes down and then it goes up. You can see the capsule up there too. Okay. And this is exactly where parathyroid is, the lower parathyroid.
So how do you go in? Where will you go?
So this is the front view of the thyroid gland. You can see the gland that looks like a butterfly sitting on top of the breathing tube here, just underneath the voice box. If you were to turn the gland around, on the back side of it, you'll see the four parathyroids. You could see the breathing tube, you could see the thyroid gland going over it, and then you could see the parathyroid that had a shadow underneath it. Because the abnormal parathyroid gland was the inferior right one here, in order to get to that, I'm going to make an incision right in the middle there, stand on this side of the table, and I'm going to lift up the thyroid, and just underneath it is the parathyroid. I'm going to find the blood vessels, disconnect the blood vessels, and close them, and then remove the gland. Close the incision, get a sample of another PTH, sample of blood for PTH testing, send it to the laboratory, and that's it. The case is done.
So I'm here at Larian Surgery Center, and it's the morning of the surgery, and I'm just really excited to get this over with.
So we're going to go ahead and do the surgery. She's ready. She's just going to sleep with a little bit of sedation, and then we're going to give her the block in the neck on the right side here, and that's going to completely anesthetize the neck and the area of the parathyroid. Once that's done, we'll put the drape on, do the minimally invasive procedure, and be done. So Cheryl is having a parathyroidectomy in supine position. So we're going to make the incision in a skin crease here in the lower neck. We're going to measure it to make sure that it's about 1.5 centimeters. So she's resting comfortably with a little bit of sedation, starting to make the incision. So we're going right in the midline. So this particular gland is actually inside the thyroid a little bit. So it's going to take just a tad bit longer to get inside the thyroid, get this portion out without damaging the thyroid itself. Because this was inside the thyroid, I had to identify the nerve and make sure we're far away from the nerve so that it won't damage it. And now I'm closing the blood vessels. And there's the tumor. Okay, so we're done. All right. So this is the tumor. Listen up. And once the skin is sutured together, we can wake her up and she'll be done. So the surgery went very well. The parathyroid adenoma was inside a little bit of the thyroid gland, so we had to explore a little bit more and get it out. We had to find the nerve to make sure it's protected and not involved with this tumor, so it wouldn't be damaged. Everything went well. She's awake. She did fine. Not a problem, fortunately.
So surgery is over. I'm resting comfortably, and everything went well. I'm just so thankful for Dr. Larian. I completely trust him.
The blood test, which showed the PTH levels to go from a level of 57 before the surgery to 21 after 10 minutes after we removed the parathyroid adenoma, which confirms that that was the only one that was abnormal.
I'm really not in much pain. I just feel a little bit in my throat, but maybe on a scale 1 to 10, maybe a 2. And I'm just ready for my coffee. So.